I did gained a lot of weight kind of over time, pretty athletic when I was younger, and then just as the years went by, I kind of kept getting bigger and bigger, and I just wasn't able to do all the things that I wanted to do with my kids and with my family.
Joe Denny needed a solution to a weight gain that was slowly destroying his life.
Diet and exercise is way less than 5% of people are able to maintain significant body weight loss for 3 years or longer. Whereas with bariatric surgery, that number is 50 or 60% of folks are able to be successful long term.
Denny did his homework and then chose Norman Regional Health System's Journey Clinic for his procedure.
Evaluated all of the surgical options in the Oklahoma City Metro and picked Journey specifically because of that holistic sort of team-based approach.
Leading the team-based approach is Dr. Lana Nelson.
It's just amazing the types of things that we can do through minimally invasive laparoscopic surgeries.
Dr. Nelson founded the Journey Clinic and has been working with bariatric patients in the Moore Norman area for 11 years.
When I got to meet the patients, that really kind of put the icing on the cake, so to speak, just because they're such a great group of people to work with. You get the opportunity to work with patients during a big change in their life.
When they come here, I also see them every single day. So I'm a familiar person, they trust me, they can ask me questions, and so that's really unique, and I get to build a relationship with them.
Miranda Matlick, Norman Regional's bariatric coordinator, is herself a bariatric patient and a nurse.
Well, for Barry's, it's important because we don't want them to come in and feel like they're sick. They're not sick patients. They're here, they're trying to have a lifestyle change.
She also leads the support groups at Norman Regional's 28-bed bariatric facility.
Every room is private, so it's unique, kind of a unique setting. So when they come in, it's almost like a home setting.
It's an award-winning bariatric program.
We were chosen in 2017 for a Women's Choice Award, and we were chosen for our comprehensive center with our great patient outcomes.
And it's accredited by the Metabolic Bariatric Surgery and Quality Improvement Program.
Norman Regional is a comprehensive center, which means we see all types of patients.
The most popular surgical choice is the gastric sleeve.
That involves actually removing part of the stomach, and so what you're left with at the end of the surgery is a stomach that essentially is shaped like a banana. It does two things. One is it reduces the volume of food that you consume in order to feel full or satisfied. But the other big thing that it does is it reduces production of something called ghrelin, which is a hunger hormone, so it actually decreases physical hunger signals for people.
Recovery after the minimally invasive surgery is quick.
A night or two stay in the hospital. Many patients are back to work within a week or two.
Dr. Nelson says most insurance companies do cover weight loss surgeries.
The majority of the procedures that we do are actually covered under insurance. Even insurances such as Medicare will provide coverage for that. And we're really excited because in 2017, the state health insurance Health Choice is adding coverage for weight loss surgery, and we really feel like it's going to benefit the state health employees.
Candidates for bariatric surgery are typically patients who have a body mass index, or BMI, of 35 or greater with health problems related to their weight. Problems like type 2 diabetes and sleep apnea. People with a BMI of 40 or greater are considered candidates regardless of health problems.
Typically when your weight is that high, it's a matter of time before the weight starts to impact your health, even if it hasn't yet.
Bariatric surgery is just the first step in successful weight loss.
Ultimately, in order to have long-term success with weight loss, you have to make long-term changes. If you expect that surgery is going to do the work for you, then you'll be disappointed in your results. But surgery can help people get to where they're unable to get to on their own and have great success with weight loss.
But Dr. Nelson says that success is really sweet.
People get really excited when they're able to do things that they haven't been able to do before, whether it's an activity or whether it's fit in some clothes that have been in the back of their closet for a really long time.
Back to Joe Denny. This past summer, 3 years after a walk around the summit of Colorado's 14,000-foot Pikes Peak left Denny gasping for breath, he returned to the Rockies with a different goal in mind.
My wife and I went back and we actually hiked all the way up Pikes Peak, and there was no way I could have done that pre-surgically. 14,115 feet to the top. 12.3 miles is the length of the hike, and you gain 7,500 feet in elevation over the 12.3 miles, so it's pretty steep.
And that's what makes Journey Clinic so satisfying for Dr. Nelson.
It really kind of allows me to see how spectacular life is.
For more information, call 405-735-2049 or visit journeyclinic.com, where you'll find a useful tool to calculate your body mass index.